Hello, now we are covering material management, especially in case of hospitals. So, when I am covering this topic, I would take the example of our PSC where we have done inventory management and material management. Okay. Now, starting with what is material management? Material management is a scientific technique concerned with planning, organization and control of flow of materials from their initial purchase to the destination. So from where it is purchased to the point of it will be given, that is destination to the patient, the product or the use in case of ward, labor room, anything. So to the point of this, destination, the scientific technique concerned with planning, organizing and control of flow of materials from the initial purchase to destination. So this material management basically consists of basically, if we have to say this, we'll say this in this way, that it is the right material in right quantity which is at the right time placed with right price from right sources at a least cost. So the right material is there in the right quantity at the right time, it is available to us with the right price and from the right sources. Okay. So 5 things, right? 1 material, 2 quantities, 3 time, 4 price and sources. Material, quantity, time, price and sources. Okay. So this would depend on these 6 steps. The 6 steps which are there in the material management are: number 1, we have to see the demand. We have to forecast the demand in our system or healthcare facility. Then procurement. Then we have inventory control, how much to order, inventory control. Then issue and distribution and storage. Then disposal and condemnation, and minimizing losses and pilferage. Pilferage meaning theft, okay, or destruction. Okay, so number first is how do we forecast what will be our demand. This will depend upon these 3 things. Okay, number first is last period demand. Last period demand means that what was the amount that was taken in the last month. Okay, like if we have to order for August, we'll see what was the supply in July. Okay, so this would not take care of the distribution pattern, epidemiological distribution of pattern of some disease. Supposedly in August there would be more cases of fever, so more paracetamol would be required. Or thermometers would be required for the same. So that would not take into account the epidemiological distribution of that disease. That would not take into account the random variation that can happen because of increase in flow of patients, etc. So this is LPD, last period demand. Then there is arithmetic average or a moving average. Moving average means for the last 3 months we'll see what is the flow of the product or the material. Okay, then we'll average it. This would be month 1, month 2, month 3 divided by 3. Okay, so these 3 things help us to forecast our demand. So we should know our demand. Before knowing our demand, before placing the demand, we should also know what is our existing stock pattern, what would be the epidemiological disease pattern during that duration. Okay, suppose we are ordering for 1 month, so we should have an idea about the disease pattern that are most likely to happen. How many births are expected, how many fever cases, how many emergencies, etc. Okay, that would depend upon the morbidity of the hospital and morbidity of the population that the hospital caters to. Okay, so this would be a first step. The first step is demand forecasting. Okay, next is another concept, which is standardization of demand. Standardization of demand means that that we should not place orders differently for different timings. Okay, First is like, if we need paracetamol, we have to place paracetamol 500. Okay, if there is, you see paracetamol plus diclo, you see diclo, you see ibuprofen, you see different NSAIDs, it is better that you stick to one kind of drugs, one kind of instruments for its standardization of demand. For that, you don't duplicate stuff, and there is an easy flow of materials and they are used properly. If we have 10 types of NSAID, and in an unequal proportion, that would not help us to help us in the smooth flow. It is better that if you have one type of each. If you have one BP instrument, you have that. If you have one type of NSAID, you have diclo or you have ibuprofen. It's better to have that, okay, etc. So that is known as standardization of demand. Next is procurement. Procurement could be either centrally or it could be individually. Generally, we had this in our PHC, a central procurement for all the drugs and materials, but it was also divided between AIIMS and Haryana Supply, you know that. And then individual could also be done for each of the items, okay. So it could be central or it could be individual, okay. Then we have after the procurement, if it comes on receipt, we should also inspect the inspect the material that we have received and then store it properly, okay. Then our third step is inventory control. In the inventory control, it depends upon all this analysis that we are covering here. First analysis is the ABC analysis. ABC analysis. Then we have VED analysis. These are the concepts that guide us how much should we order and procure for a smooth flow of material, okay. Then we have economic then we have economic order quantity, okay. This is order. My writing I could not understand. Economic order quantity. Then we have lead time, we have reorder point, and we have another analysis known as FSN or SDNE. Okay, let's cover this one by one. What is ABC analysis? ABC analysis is based on cost criteria. ABC means always better control, okay. This depends upon the cost of the items and how much we should control them. So in category 1, we have category 3, category ABC, the percentage of items that needs to be ordered and the percentage of the cost that they have. So in category 1, we have 10% of items which cost 70% of our budget. These are costly items and these needs to be controlled and managed with the highest level of authority. B, supposedly, like, these are costly items in the sense like we take UPT or we take medications which are very costly, okay. So like those. Then B is that percentage of item is also 20 and cost is also 20. C is that percentage is more and the cost is less, like paracetamol, cetirizine. This comes as a low cost to us, okay, and this should be present in bulk amount with us, okay, and the level of control can be lenient in this, okay. So this is ABC analysis. A, B and C: percentage of item, percentage of cost, 10, 20 and 70, 70, 20 and 10, okay. Next is VED analysis. In VED analysis, that means vital, essential and desirable. Okay, this depends upon the critical value and the shortage cost. Like, what will happen if that drug or that material is short to us or is in a critical position, okay. So whether it is very much vital for our sustenance, essential or desirable, okay. So this vital thing should always be there at all times with us. At essential times can be there, but desirable things can be there or cannot be there. That depends upon our resources, but vital things should always be maintained, and this is known as safety stock. The safety stock should always be there. Okay, the next we'll cover is FSN. This depends upon the utilization. Utilization meaning fast moving, slow moving, and non moving, like IFA, calcium, paracetamol. This would be fast moving. Slow moving would be your antibiotics. Non-moving would be those things like labetalol or isosorbate mononitrate, only for MI patients we use, etc. Okay, so next is SDE. That would depend upon the availability of that product. That is scarce, difficult, or easily available. Supposedly we have some material which is very rarely available, so therefore we have to use it in a way that we don't destroy it. And easily available should also be maintained, but this depends upon the availability of a stuff. Like paracetamol or levocetirizine can always be procured locally as well. But if you want to procure some drugs like MDIs, metered dose inhalers, or something like that, which is scarce and difficult to procure from our system, so they should be released slowly. Okay, or we get it sometimes only, like that. Okay, so SDE depends upon scarce, difficult, and easily available, depends upon the availability. FSN depends upon the utilization, fast moving, slow moving, non moving. VAD depends upon the critical value and shortage, what would happen. And ABC depends upon the cost. Next theories are lead time. Lead time is a time between let's see here. Lead time is the average duration of time that is from the placing the order to its receipt. Okay, this is the average duration of time that we can expect for a drug or material to reach us from the time we order it. Okay, this could be internal lead time or external lead time. Internal lead time means supposedly the nurse has given us that whatever she requires in the next month. Okay, we take 10 days time to order it. So that would be our internal lead time. External lead time is that when the central agency or the person has already received the drug list, that would depend upon that would depend upon the external lead time. Next is economic order quantity. Economic order quantity is a concept which decides us how much purchase cost or order cost or holding cost would be for that. Okay, economic order cost would depend upon average monthly consumption into the मतलब कितना consume हो रहा है वो, into lead time, which should be taken in months. Okay, generally the lead time is around 2 to 6 weeks. Let me write it. 2 to 6 weeks is generally the lead time, plus the buffer stock and minus the stock in hand. This is economic order quantity. Average monthly consumption into lead time in months, into buffer stock and stock in hand. Okay, this is economic order quantity. Reorder point is that at what time the stock should be replenished.